which is designed to bring together researchers and organizations or individuals that have a real world experience in any given topic that we discuss. So our aim is basically to highlight the key research findings in a never kind of changing evidence world and how these can be used in practice. So just trying to make evidence more accessible and relevant to you in the Tackling Loneliness Hub. So today I'm really pleased to be chairing this event that will be supported by two of our lovely speakers. We are going to start with Liam Wrigley, and I will allow him to introduce himself in a moment. He's an assistant professor at the University of Birmingham, and he together with Sally Carr will be addressing loneliness among NEET, as we say, so people not in education, employment, or training. And we hope this is useful for you. So we will start with Liam's presentation. That will be followed by Sally's presentation, and we will take questions in the end, if that's okay with everyone, just to allow a little bit of a flow during the presentation. You can pop your questions in the chat. I will be monitoring the chat as well. Or, of course, if we are a small group, we can always unmute and ask questions in the end. So, Liam, would you like to start your presentation?
Absolutely. Thank you so much for that gentle introduction, Antonia. And I'd like to thank yourself, Abba, Sally for joining us, and also Andrea Wigfield, who is a co-director of the Campaign to End Loneliness. So my presentation, along with Sally, is titled Addressing Loneliness Amongst NEET Experienced Young People. We're going to offer our insights from youth work practice and academia. The very essence of this presentation is to work together. So I've had previous experiences within youth work, professional youth work, grassroots youth work, etc. But I've worked with Sally in Greater Manchester for over 10 years. So I was one of Sally's service users a very, very long time ago. And Sally supported me in tackling my own loneliness and isolation and finding a suitable pathway. So I wanted to kind of just show who we are and what we do. So as I've said, I've had experiences of being a youth worker previously, and youth work volunteer. But what is youth work? So this is about the empowerment of young people. Often we do grassroots youth work where it's community based, it's free to participate. And it is based around informal education and empowering young people to become to an equitable outcome. So here's some of the photos of like our practice, and I'm involved in, so you can probably spot us there as well. I'm just going to come off camera for a second because it's a little bit distracting. But Sally will come on to more of what we do and youth work practice and what that means. But the context is really, really important about the value of youth work in addressing loneliness amongst young people. So my colleagues James Duggan and Janet Batsleer in 2021 written a book called Young and Lonely, and they looked at how grassroots youth work can empower young people to challenge their own loneliness and sense of isolation. But as we know, for the experts in the room, just as a bit of a reminder, that it's defined as a subjective and unwelcome feeling of lack of loss or companionship. So that's quite a dated definition. And it can also refer to the mismatch of perceived quality of relationships. So in academia, I look at young people's social relationships, social ties, and social connectivity. And how this affects young people in terms of their relationship with their family, their friends, their wider communities. And it's also really, really salient as well because 1 in 10 young people aged 16 to 29 report feeling lonely, often all the time, whilst 82% of youth workers have said that loneliness affects young people and the way that they operate within youth work practice. Youth work has been absolutely devastated by austerity, so I don't say that lightly. And my colleague, Tanya Di Sanqua, often discusses how neoliberalism has affected what we do as youth work practitioners and also youth work academics. So a lot of practices have become marketized. This kind of relationship with measurement, really, really important, using quantitative techniques to basically prove that they're meeting outcomes, competition between youth workers and service providers, and often collaboration with welfare agents and the police. So we question that and what that means for young people and their feelings of loneliness and social isolation. Moving forward, this is a really, really important factor to understand that young people come with a plethora of needs that need to be addressed and often are not addressed within wider society. So youth work is often an opportunity to tackle loneliness for young people at their own point of call. You know, it's free to participate grassroots youth work. In my own research about young people who are not in education, employment, or training, the young people were more likely to have a plethora of complex needs, such as an SEND statement, an EHCP plan, so that's an educational health or care plan, and have more than twice as likely to experience NEET in early adulthood, and also repeatedly more likely to go missing from home or care settings. And we can also see in popular media and that discourse about how young people who experience being not in education, employment, or training are portrayed within society. So there's a lot of stigmatization from top down. And we start to see this in terms of how this affects young people in terms of benefits, in terms of the welfare state, in terms of how they're reported. And also looking beyond into their trajectories into adulthood, such as being less likely to gain employment in adulthood. But this is not the only thing that we see young people as youth work practitioners, as scholars who study youth work with young people. So young people are much more than that, than their education, employment, or training trajectories. And as Sally will show shortly, about how young people are empowered, about how we scaffold those relationships with young people. So a little bit about the research that I've done previously, and this has involved Sally as well. I mean, it's part of an ongoing conversation about young people, as I've said, who are not in education, employment, or training. So this was initially a narrative study. So I was gathering young people's narratives across Greater Manchester who experience being not in education, employment, or training. I kind of fell into studying loneliness accidentally because it was a key finding. And if you've read Professor Wigfield's book, Tackling Loneliness for Dummies, you will see about how participatory methods with young people have been used, i.e. using sociograms, and elicitation tools for young people to talk about their social relationships. And this is how I fell into study loneliness. So I was exploring the wider intersectionalities of care, welfare, stigma, social support, and how they were class, gendered, and also racialized. But within those conversations with 16 young people across Greater Manchester, I actually found that loneliness was, and feeling like a lack of connectedness was a big, big, big theme within the research. So, as I said, kind of fell into that accidentally. And then I was supervised by Andrea when I did my PhD. So, you know, I was in the right place, right time. Um, a lot of young people actually did blame themselves and feel that stigmatization of feeling lonely and lack of connectedness. And they blame themselves through their lack of participation within education and employment. So we started to see that, but it was my argument that this wasn't actually equitable for the young people. So we need to arrive at a point, we need to meet young people halfway. And this is what's part of scaffolded transition. So building young people up, that was a really, really important finding from my own research. And some of my later work that I've done with Andrea and others have explored NEET experienced young people, loneliness, and this is a global policy issue. So it's a very much a hot topic, and they very, very much intersect with each other. So some of the methods that I used within my study, so this was carried out from 2019 to 2020. There's follow-up research taking place with young men who are not in education, employment, or training. Um, However, it was an applied qualitative research project with 16 young people, a series of youth workers from across Greater Manchester, careers advisors and support organisations. Um, and we actually followed up with 4 organisations. So one that was a careers advice service, one that was a grassroots youth work organisation, and with program managers and employability courses and informal education courses. And to the left of the screen, or it might be the right, depends which way you're seeing it, you can actually see a circle, centric circles of about 4 rings. And this is actually a sociogram method. And this is something that I used as a tool of elicitation during narrative interviews with young people who are not in education, employment, or training. And they actually explained what their social connections look like to give me, as a researcher, a bit of an insight. So this has historically been used as a methodology within youth work to gather conversations with young people, to break the ice. It's also been used in social work and teaching. Started with the work of Mary Northway in 1951 for isolated young people to explain their social relationships and who gives them support and what that looks like. And this is from one of my participants, Autumn, that was carried out in November 2019. And we actually saw how Autumn's social relationships changed over time and who they were getting support from and who they wasn't, and how they articulated their social relationships. And it comes within a microcosm of explaining family breakdown, problems with lack of scaffolding within education and employment, but also wider feelings of loneliness and feeling like they've got no friends. So there was a lot of self-blame, self-shame, and self-deprecation. And it was part of my role as a researcher with my youth work hat on, to kind of speak to the young people in a way that was equitable and kind of looked as well that I was genuinely involved in their lives, and I wanted to help them get to a point where it was more equitable for them. So these deep ethics of care were really, really important. And several of the young people were actually care leavers. So they were transitioning from local authority care, living in independent living for the first time. So when they've lived in local authority care, that could be with a variety of young people, but they actually explained feeling so lonely within that care setting with other young people. There was often incidents of violence, disorder, the police being phoned constantly for testing boundaries with care workers and support staff. So the wider adultification of young people, and we can see that in other research, adultification bias is alive and well within society. And we also seen as well that Harvard actually had experiences of education and employment and the precarious care workforce. They were involved in work programs, they were providing a lot of care as well for sick relatives, but they actually felt that their needs weren't being met. Okay, so their social needs. So if we go back to the original definition of loneliness that I offered in the first slide, the lack of perceived connectivity was really, really important. But what we did actually find, and some of Sally's work has found this as well, is that these long-standing reciprocal care relationships. So, when Sally intervened with me when I was a young person, feeling isolated and lonely. That long-standing care relationship still exists today, as a young man in my 30s. So we can start to see how those care relationships evolve. And as well, in this case, it's become a professional relationship, working relationship. And we started to see that as well with the organisations that I worked with during my doctoral programme. And it was really, really important in terms of how the support workers articulated the lack of connection and loneliness amongst the young people. So, say, for example, Jenny, who was a careers advisor, not a youth worker, but she was trained actually as a youth worker. She'd done a JNC course previously, where she was talking about young people living chaotic lives. They might have problems with housing, family, addiction issues, and they're not ready to settle down and engage. And then that has a knock-on effect on the welfare system and the seeking benefits when they turn 18, if they're not able to find financial remuneration. And the young people as well actually did explain that they did feel like they had some kind of support, but it just wasn't adequate enough to address their needs and their feelings of loneliness. For example, Autumn described how mum and dad were the first people who she'd go to. She was fortunate enough to still have them in her lives. And that her boyfriend was very supportive. So she had a wider network of social support, but she also had a lot of relatives with fleeting, socially supportive relationships where she felt isolated from them. And also, we actually have to articulate the difference between social isolation and being isolated and loneliness. I know that is a lot of contention within the literature and also these young people. And then Walia, a young woman from Greater Manchester, she did actually try to speak to her mum. She said she had a deep caring relationship with her mum. She loved her mum very much, but she had significant mental health issues and issues of self-harm. And she described like a cultural understanding of where she just thought she was classed as crazy, and she wasn't actually like supported in terms of getting mental health support, in terms of having that understanding within the home, in certain aspects of her life. And also, as well, we have to question the role of the COVID-19 pandemic, austerity, and geopolitical conflict that's occurring. So the world's a really tumultuous place right now. And the National Youth Agency has actually identified that since 2010, youth services, both targeted intervention and grassroots youth work, have experienced funding cuts. And this really fell into the research that I did during 2019 and 2020, and the ongoing research that I'm still doing to this day. So we've experienced a loss of 4,500, and that's only got bigger, frontline youth work, qualified youth workers, and concerns that, NEET experienced young people are becoming further isolated, further marginalised in terms of criminal exploitation, county lines cuckooing, school exclusion, etc. So we start to see this becoming a wider ecosystem of problems and social problems. And I've articulated this in a recent paper that I had published in Journal of Applied Youth Studies in 2024. So that was only last year. And that actually did look at loneliness in a way. It kind of anchored loneliness through looking at stigma, and stigma as a top-down process mediated by government policy, hostile rhetoric, sanctioning, and those that are classed as agents of the state. And support workers, youth workers were often doing a great job in very difficult times at bridging those gaps and those network gaps within the young people's social connections. But we also have to acknowledge that the pandemic and the cost of living crisis created a platform where stigma was amplified and social abjection. So abjecting young people in these ways was very, very much utilised within media, in government policy, and often young people feeling blame and internalising shame. So the question about how we're able to scaffold these transitions into adult life as youth work practitioners, as youth work academics, we start to see that evolve and kind of really vehemently take shape. I'm going to now hand over to Sally, my colleague Sally Carr, who is place director for Street Games UK. Thank you.
Liam, that was brilliant. Thanks so much. I learned so much. They're absolutely fascinating. Thank you so much for that. I have got some slides, and I wonder if I could show the slides that I've got, Liam, which is exactly the same first slide, but I've done a bit of tailoring just to kind of bring it a bit more up to date. So would it be possible, if okay, if I can share mine?
Yes, yeah, you can share. Just click the share button.
Thank you, thank you, thank you. Okay. Can you see that, folks?
It's just coming up now, Sally. Thank you.
Okay.
Yeah.
All right. And hopefully we'll get it from the beginning so I can get it on big screen. Let's get in below. Is that good? Big screen for everyone?
Yes, very good.
Thank you very much. Thank you. So thanks for inviting me. I'm really happy to be here. So my name's Sally Carr, and I currently work as Place Director Northwest at Street Games UK, which is a children and people's charity that has a focus on a particular way of doing sport and blending in youth work and relational practice. So suits me very nicely. So here I am, and I just want to say I have got an MBE, but I am part of the Excellence Not Empire campaign, just to qualify that. When they invited me to be part of this, I had a little look around about the kind of context, conditions of young people's lives, and I came across this, which I think was in Youth and Policy. And I thought, yeah, absolutely, this is what we've got. And part of this is because of those cuts to services that Liam touched on there, and those cuts being quite drastic in parts. And we've seen that. We've seen a significant shift where also the landscape of the youth sector these days, where it would have been 80% local authority services in 2010, is now 80% in the voluntary community, faith and social enterprise sector. So a different landscape that we're working in, and an underfunded landscape. But in understanding really about young people's mental health and this rising need, what are some of the things that are behind it, aside from the cuts, and how does it impact young people? And we've seen here about financial insecurity. Indeed, we're in a phenomenal gig culture that young people are part and parcel of, and open to exploitation or child criminal exploitation and so on. But I was also interested in social media harms and deteriorating sleep quality, and some of these things go hand in hand. And I read something recently that was interesting about young people's use of social media. Is it that it is a deficit of time that young people then have, or in the context of connections and building friendships and so on, is it a deficit of attention? Social media taking attention, young people's attention, the algorithms being designed in such a way to keep the attention. And I thought, oh, that's very interesting. And particularly interesting in this backdrop of some emerging data that's coming out, research and insight from the Department of Culture, Media and Sport, which is about, hopefully in January, to launch the new National Youth Strategy, Today's Youth, Tomorrow's Futures, that reported that they had found that 70% of young people's time is on screen, 50% of their time is alone in their bedrooms, and what young people are craving is in-person contact. Now, I came across this on LinkedIn because that's how academic I am, and I thought this is very interesting, and I asked my partner, who's very academic and is also a therapist, I said, is young all right? And she said, well, he's of his time. So this quote is of his time, but I thought, actually, this is very interesting. And it's about people, it's not necessarily that you're in a crowd and therefore, or not on a crowd, that loneliness occurs. It's about this sense of things that you're unable to communicate. And, you know, Liam touched a little bit on intersectionality, and I want to talk there, the extension of that, about intersectional discrimination, that either gives you power or takes power away from you in the construction of society, and indeed this volatile landscape that we're currently in. But I also want to mention this quote from last year from a young man who was 13 in Warrington. It was a peer research project. And one of the lines that came out of this peer research project that really struck me was this young 13-year-old boy saying, "I just want somebody to notice me." So that absolute craving for connection, where youth work plays an absolute relational part in this. It's a relational practice. I'll touch on it as well. It operates more in this informal space, or at least that's where it should be. It's about a voluntary rather than a mandatory relationship. It's about understanding that we are positioned within young people's lives and within young people's geographies. So we have a unique role in their safeguarding in that sense, a contextual safeguarding lens on this, where we can also act as the bridge and the translator of young people's lives to those statutory services who maybe they are more positioned within a mandatory relationship with young people as teachers, social workers, probation officers, police officers, and so on. But positioning the Lundy model of youth voice within this is from Professor Laura Lundy at Queen's University, Belfast, which has 4 aspects to that youth voice model, and I think is applicable across many different systems. A plea really to use that. And that we are the privileged witness because of the position that we're holding in young people's life, this unique role. We're in their geographies where young people are at. So youth workers having this position of privileged witness in young people's lives and being able to translate that so that we can ensure the context of young people's lives are better safeguarded. And I guess, you know, for those young people who are NEET, who are experiencing NEET, the multi-layers that contribute to that becoming so important if we're going to unlock young people coming into further education opportunities, employment education, training opportunities. And I just wanted to put this up because, of course, it comes up that time and time again, people talk about hard to reach groups. And it's interesting, hard to reach groups, hard to reach individuals. It's hard to reach services often. And somebody said something today which I thought was very wise. And they said, yeah, and a reluctance to stretch. And I thought, oh, yeah, that's profound. And we do have to stretch. We have to come out of our comfort zones and stretch into the lives of children, young people, if we're really to make a difference. So that positionality that we need to consciously create. And this brings me into this understanding, an extension of youth work into therapeutic approaches for youth work. Young people report time and time again this therapeutic aspect of youth work, this relational practice that's made the difference. Liam himself reflected on it. The longevity becomes possible in that relationship, the scaffolding around it, where we position care and enabling features, because care in and of its own can be disempowering, and we do want to be empowering. I talk about enabling more than empowerment because I don't think you can empower people. I think you can offer enabling processes and then people empower themselves because the scaffolding is built around it. This is where therapeutic youth work comes into its own. But I also want to talk about, you know, intersectional discrimination in this therapeutic youth work, because you can't be offering just a therapeutic approach without addressing the harms that have been caused and the injustice that young people have faced. And this is where Dr. Ron's work comes in about healing requires justice, not just therapy. And for these NEET young people, the multi-layers of needs and vulnerability, the experiences that they've had, where sometimes their safeguarding has been conditional through process such as adultification. And safety isn't something that is something we build together. It's not just something we manage. And this is really important because I do think we're in a management culture. You know, the voluntary community-based social enterprise sector increasingly having a business focus. We're talking about people's lives, and we have to position children and people's lenses in these lives and a child-centred approach absolutely in it, because we build safety together. I come back to young people's geographies. They know things that we don't know. We have to build this together. I've put this little to the right of the screen there, this compass, which looks at this approach that I developed through therapeutic youth work called REACH, which is about the R being therapeutic relationships, the E being therapeutic environments, and so on. and you can pick this article up, so Youth and Policy from 2022. But I'll just go into a little bit of the pre-work that I always find needs to happen before you can get into that reach, that stretch, that accepting that people aren't hard to reach. We just have to apply particular processes. And the first one is about being present in young people's lives, understanding their lived experiences, their stories, their preferences, their joys, being present in those conversations. So I will often describe myself as a strategic leader who is practice informed. So I'm still present with young people, grounded in that sense and understanding what's going on, but also taking notice. I am a professional practitioner. You know, I have a safeguarding duty here. I'm taking notice all the time. I'm looking who's talking the most and who's talking the least. I'm looking at those views and those communications that are coming out. But in a safeguarding context, I'll give you a really clear example of taking notice. I'm noticing in a youth group session who's eating all the biscuits because they might be experiencing neglect. And there comes the layers of needs and vulnerabilities to take notice. But attune, because young people are diverse, they're not all the same. So we have to attune, and I have to attune, understanding that at times I might not be the right practitioner for this particular young person. There may be other youth workers who can attune better than I can. And that is understanding my power, my privilege, my positionality, and attuning to the young person so that I can connect. And it is that connection when we're talking about loneliness. We're talking about meeting people that becomes incredibly important. That connection has to be genuine. And when we can have a connection that has got longevity, even better still. Because that helps us to build the scaffolding around this. Things don't happen overnight, and a lot of programs are quick sticks, 6 weeks, 12 weeks, funding, sometimes 6 months, a lot of funding for the voluntary community faith social enterprise sector being 1 year. We need substantial funding 5 years if we're going to be making a difference at the minimum in these young people's lives who are experiencing these multi-layers of needs and vulnerabilities, intersectional discrimination. And we need those anchor relationships. We need those practitioners in for the long haul, doing that relational practice, sometimes operating between the gaps and spaces that other practitioners in more mandatory relationships can't operate within because of the constraints that they face. But scaffold and anchor for me are incredibly important. And I'll just do a little bit of unpacking this. I'll go into an understanding of this intersection of racial discrimination and homophobia. And I'll give you some stats just to get us going. So I am queer, but I'm also a Romani gypsy. So in an intersectional lens, I just wanted to talk about this, that for young Irish traveller young men, 7 times more likely to have death by suicide. And for LGBTQ plus young people, we see a 2.2 times more likely to experience this compared to their heterosexual counterparts, and of course self-harm being in this mix. But we're also in this cultural context. Here is a quote from Families and Friends of Travellers. It's saying, we make our young think there's something wrong with them. There's nothing wrong with them. They just need a little help. There's no shame in that, none at all. The stigma needs to go. Too many of our young people are dying. My beautiful boy is gone because he was too ashamed to seek help. So this is the condition, the context of these lives. And here's also a little bit a kind of extension of this in an intersectional lens about understanding those queer gypsies, essentially, where we're told in our culture, there's no queer gypsies. Well, of course there is. And there are good numbers of us as well. And we need to be actually in a context where we can express our full identities so that we can connect, we can build friendships, we can belong, but we have to change the context of the racialized and LGBT phobic environments that we operate in. Apologies, I don't seem to be just moving on at this point. I'm going to stop sharing and come back in, so bear with me. I see you're all quite transfixed, which is good. Okay. All right, so I'll just drop down to where we were. Lovely. Nice. Let's see if it shows it. There you go. I want to show this because sometimes, you know, we've had all the raise the flags, haven't we? Well, there's our flag for the queer gypsies, created by Dr. Daniel Baker as an expression of us being able to be. So I just wanted to share that with you. And here is Traveller Pride, and they're saying it's easy to feel like you don't fit in with the traditional traveller world because of your sexuality or gender. I'd change that a little bit. I would say it's because of LGBT phobia that exists rather than us being ourselves, and that you don't fit with the LGBT spaces because of discrimination. I'm letting you into this really because of this example I want to give you, which is, I try and avoid the word case study, so I'm offering you an experiential story here from my practice of a young gay traveller man. He was 24. So it's the upper end of youth work. There's 25 is where we kind of stop and transition, particularly for young people with additional needs. And this young man came really older, 24, and he walked into the LGBTQ plus youth group in Manchester, and then he walked right back out. But I was present and I took notice and I saw this. So when I'm talking about be present, take notes and attune and connect, here's what I did. I started to look at this framework of reach. So I'm unpacking this step by step for you, because what I realised is I did have to be present, I did have to take notice, I did have to attune and connect. But what does that mean? I'm going to have to do the scaffolding and anchoring of this in order to be present with this young man. So it's very informal. I went out and said, "Are you all right? I'm Sally, how are you doing? How did you get here today?" Nothing that was personalised too much for him. But I got this quote here. I just thought it's important that the environment is a hidden hand that shapes human behaviour. He was happier in the street than he was in the building, and for good reason. And later on in our conversations and our relationship, the street became less of a safer place for him, but the street offered many exit routes at that time. In the activity, I'm talking about the right time and the right style, and often for our NEET young people, the right price. And just to take the poverty stigma of that, never free, always fully funded. When we're talking about the conversation, this is a quote I picked up from last week's contextual safeguarding conference. It said, "The stuff you only talk about when you feel safe." So this is the attunement to young people, but always in this healing-centered framework that looks at the social, the mental, the physical health of young people, rather than dissecting them into these aspects, take them as the whole and center healing and justice in this. This example here, for me, is poignant because yesterday I was at Greater Manchester Combined Authority doing some work with them about better supporting Romani gypsies, Irish traveller and Roma young people. And this young man, who's now in his 30s, was present with me as a partner in practice, being able to talk about this work and influence it. So I'll come back to this idea, something safety is something we build together, not something we manage. And there's a clear example of it. But I also wanted to come to this because sometimes we pathologise young people, NEET young people who are experiencing loneliness, young people that we kind of then say, "Oh, well, they've got a mental health problem." No, no, no. Look around in this picture. Look at the context that this koala is operating in. It is no doubt. And I wanted to mention this because for that intersectional discrimination, for those young people who are NEET and possibly experience loneliness, hypervigilance is absolutely there all the time. And we talked about minority stress and things like that in our practice. It is there. And whilst we only rely on things such as cognitive behaviour therapy, we pathologise the individual rather than look at the context of their lives and changing that. And in changing the context of the life, I just want to bring you, as I come to the end of this presentation, to my work at Street Games, where we position youth work and we position sport. We have this pedagogy. It's very simple: the right people, the right place, the right style, the right time, and the right price. That pedagogy allows me to build within it with great flexibility the opportunity to queer sport. So when I'm working with LGBTQ plus young people who, from the data I showed earlier, you've seen how they experience loneliness and potential death by suicide and all sorts of things. Sport, for me, offers anchoring relationships, great scaffolding over the life course. And we take into account that it's more than physical. It's about how we create these contexts so that the social connections, the ability to build friendships and sense of belonging comes through over the life course. It doesn't stop at 25, but also how we're conscious of their experience, their lived experiences that have impacted their psychological and their social well-being. So how do we put it in? And in queering that sport, you just can't, you take the children and people's voice in centrally with it and you co-create around them. Here's some nice photos from last year's Pride Youth Games. So it's not all here's an example of rugby, but it's not all rugby. Middle photographs about circus skills, and then we had a little bit of adventure activity with a climbing wall, but we also had some mindful sewing so that we could have some conversations in a space that was more appropriate, in particular for the young people who neurodivergent. So queer in sport, enhancing belonging, taking loneliness down, building friendships up. And the role of sport as social scaffolding comes into place. Here's an example of another young man that I worked with some years ago. And this is our WhatsApp exchange, because he also walked into the cafe. And we had a community cafe at the time, and walked out again. And I followed him, and he came back in, and we sat down, we had toast and tea. He hadn't eaten. He was in a bad way. He was shaking, and we were talking. I managed to get him through his level 2 badminton leader course, and then he led. And here's the example of him leading, because he wasn't prepared just to buy kit for 2 people. He bought 4. So it cost me more money than I had. But it was good. It was good, and it was good outcomes for him. He's thriving these days. But here's something just a little bit more about the mental health benefits of sport, because if we get sport right, we can build the anchoring relationship, we can build the scaffolding over the life course, and young people can build those friendships and a sense of belonging. So that brings me to an end of my presentation. I hope it was useful. And I just want to say that, you know, when we're talking about NEET young people, the sports ecosystem is absolutely massive, and the job opportunities available are there, and people are crying out for youth workers and youth sports practitioners. So it is an ecosystem. You know, there are 98,000 coaches, officials, and so on in the UK working in sport. There are 6,000 qualified J&C level 6 youth workers. So you do a comparison and you think about the life course. We can address loneliness, we can address NEET, we can address death by suicide, all sorts of things if we get the anchoring and the scaffolding right. And I'll stop there.
Thank you, Sally and Liam. Amazing, really, really nice presentation. So inspiring, your talk as well, like so personal and relevant to everyone, really. I'm sure everybody has experiences of things that have to do with young people kind of being unnoticed, like you say, being just passing by and just keeping being unnoticed. So should we go to questions now? Lovely messages in the chat as well, Sally and Liam. Thanks for that. Abba, do you want to start?
Yes, please. So digital spaces, I think for a lot of young people are really important. They're crucial. So in your opinion, what role, if any, can digital platforms and online communities play in reducing loneliness among young people? And what are the risks that we should be aware of if we are going to use those?
Shall we come in, Liam?
Yeah, you can go first, Sally, and I'll
Yeah.
tail off from that.
Thank you so much. So maybe about 2 or 3 years ago, I wrote a chapter in this book on radical community development, which was about gender and sexuality, citizenship in the digital space. And what I wrote about was the ability the digital space afforded LGBTQ young people to create terms and language for themselves that describe themselves, because often the language LGBTQ plus was not created by us, it was created to talk about us. So I think the digital space offers actually some great potential if there are safeguarding structures around it that young people are minded about. Of course, there are also, we know about digital harms and so on, and the National Youth Agency have got some great workforce development pieces about youth work in the digital space that help us to enhance our practices. So, you know, I think it can go both ways. And young people are in that digital space, and the algorithms are tailored in particular ways that can be harmful and can be damaging. But I'll leave it there and let Liam come in.
There's also that's great point, Sally. There's also an issue with risk as well, and what young people are circumventing within their digital ecosystems. So, for example, you know, I had when I spoke to a number of young people from the first presentation, they were working in the digital economy in quite dangerous spaces that many older adults weren't aware of. You know, to make money, to get by, etc. And there was some jovial enjoyment of TikTok, for example, and then there was some also digital interruptions, should I say. but also going back to the Internet Safety Online Safety Act, young people are circumventing these spaces and finding connection anyway, and especially when they've got like content blocks, etc. You know, I know Australia have gone forward with banning the use of the internet in certain age groups, and I don't think that is the answer. I think, as Sally alluded to, the future is digital in terms of spaces of connectivity, but it has to be scaffolded around safeguarding structures. So young people are enacting within safety, but also making empowered choices, and that is not taken away from them. So that's really important. Thank you.
Thank you both.
Any other questions that are, you can unmute and ask if you would like. Don't have to type in the. Oh, thank you, Sally, for the link.
I think I'll just make a few points. I think both of you were just fantastic presentations, and I've scribbled things in the comments, as you'll see, because just before you often mention things came into my head in terms of my research. So there was lots of similarities in terms of sort of meaningful relationships, and Liam, the fact that you fell into loneliness research, which actually I did as well myself, and yeah, I think all the stuff you mentioned, Sally and Liam, about the scaffolding is really, really crucial. And I think often when I talk about to people, either as individuals or organisations, how do you support people who are lonely? Or if you're lonely yourself, what can you do about it? I think we often underestimate the efforts that are needed to create those connections, whether we're operating as a service provider, practitioner, or whether it's a peer, like as a friend or somebody that we work with. And I think a lot of effort needs to go into creating and sustaining what I call meaningful relationships. And so I think that's a really important point. And the point you made, Sally, about sport, I think music alongside sport, they're the two key things I would say that really are powerful in terms of connecting people together, connecting like-minded people. So that's not a question, but just to say that a lot of what you've said aligns with what I've said, and I think it's just brilliant, both what you've both done and what you're trying to do, and also I suppose the way you've come together as well through Liam's own personal experience, and that is a good demonstration of this therapeutic alliance, isn't it? That actually, you know, you've worked together in a different capacity, and now you're still working together as colleagues. So just thank you. Yeah.
Thanks, Andrea. And I also wanted to say as well that when I was a lot younger, this is going back 15 years, Sally worked at an organisation where Sally provided crisis support for me personally, and that was kind of grassroots youth work in action. And that relationship has evolved into a professional one and also a friendship. So that's great to have. And massive kudos to you as well, Sally.
Amazing. Thank you, Liam. And also for sharing their personal stories. I know it's quite brave to do that. Or often we forget to say these things to speakers when they talk about their personal experiences. Abba, do you want to go next?
Yeah, sorry, I've got another question. I just found it all really interesting. So this one would be for you, Sally. I know you touched on approaches to be more inclusive and sensitive towards like marginalised communities, but would you be able to like spotlight or highlight maybe just 3 key ways that practitioners can ensure that they're inclusive and sensitive to people's needs and cultures?
Yeah, absolutely. Thanks for the question. Do you know, my guiding principle is never do anything on your own. Never do anything on your own, because you only know so much, and other people know an awful lot more. I'll give you an example of this, just a one that's recent. In the Liverpool City region, I've been influencing for the last couple of years about Irish traveller and Romani gypsy lives, working with the Race Equality Unit. And there have been 9 other organisations involved in this as well, this influencing. And the Race Equality Unit recently brought together 2 commissions of £20,000 each. So this is, my mantra, don't do things on your own. Irish Community Care have got the reach into the Irish traveller community, and Liverpool Street Games have not, but we have got a great doorstep sport offer. So we came together, we put the bid in, they've got the cultural competency, I can add some layers into that, they've got the relationships, and actually be able to get into those communities easily, recruit some young people who we can then train as community sports practitioners. The cultural competency bit extends even further because the Commission asked for us to engage 50 people. The cultural competency on this is no way, we'll engage 6, because that's the reality of the situation in understanding the needs and vulnerabilities of this particular community that we're working with and the intensity of the support that is needed. But I think the other bit of cultural competency is understanding when it's not you, you're not the person. You know, and actually other people, I said it in present, other youth workers, other practitioners are better placed to have that relationship and be able to reach in a more trusted and genuine way into particular communities and population groups. So having that open heart, mind and will to step back and recognise that, you know, it's not a negative about you, it is a positive about the best way to reach. So there's some things there. But also understanding that even when we're talking about NEET young people, when NEET young people become EAT, so they're in education, employment, training, is it the right education, employment and training that they're in? So understanding that nuance as well. So I hope that was helpful.
That's brilliant. Thank you so much. And so I think we are coming up to the end of our time now. I just wanted to thank you again, you, Sally and Liam, for a really, really, really interesting webinar. And just before everyone goes as well, there'll be a short survey that will pop up. If you don't mind taking just 30 seconds to fill it out, just to let us know how we're doing and give us some feedback, that would be great. And Antonia, are there any words from you before we end the session?
No, just again to thank Sally and Liam for this really, really interesting presentation, and also to just say a few things that, like, we're going to obviously share the recording with all our members that couldn't be here today. So yeah, and if you aren't part of the hub and you would like to be included in these conversations, sometimes people ask questions after to our members, and there is a chat function as well. So please remain in the hub for further discussions around the topic. So thank you all for joining today.
So much. Take care now.
Thank you.
Thank you so much,
Bye.
Liam and Sally.